name is Sarah Clements. For this video, I will be doing inserting of an NG tube and also the removal afterwards. Before starting my procedure, I would go to my medical record and I would gather my supplies and see what I am doing. And then once after gathering my supplies, I would go to my patient's room. Now, before coming in to get permission to come in, I would go to the bedside table. Hi, Mr. Jones, can you identify your name and date of birth? And it matches up with my MAR. And then I would explain. Today we're going to be doing an NG tube. You have bowel obstruction, so we're going to be placing an NG tube just to release some discomfort in your stomach, okay? And the procedure is discomforting, but at any time if you begin to cough or gag, I will stop and I will give you some time just to compose of yourself. And at any time if there's any gasping or cyanosis, please let me know and I will remove it, okay? So when I tell you to drink water, all I need you to do is just drink the water and it will help persist and proceed with the tube to go down, okay? I will raise the bed at height. So waist. Mr. Jones, I want you to touch each side. You would have them touch each side and breathe in each nair to see which one they breathe in best. Mr. Jones breathes right the right one, so I'm going to do it in his right one. So that's the reason I'm on this side. Okay. And then I'm gonna set up my supplies. So we need the syringe to pull out the pH tubes. You would need a garment to place over the press just to keep them all clean. They would need a emesis basin. Give them tissue. And then I got my tubing, their water. Mr. Jones, here's your water. And when I tell you to begin drinking, you can drink. I got my clip and my rubber band to clip it after we get the proper placement. And then I got my measuring tape and my pH paper. I'm going to go ahead and put my pH paper in my bucket so once I get the pH juice, I can test the pH. So once he's in high values and you have him covered, you first want to measure with the tubing so you know how far down you need to go. I'm going to put hand sanitizer on, get my tubing. So you want to go from tip of the nose, and then once you're at the earlobe, hold it, and then this is the decisive process. So about right here, and once you got it, pinch it. Then just get a piece of tape, or you can use a marker. And I'm just gonna place it on there. So after after he gets his X-ray and after I do his pH testing, I can properly place it. So I got that. And then I got my gel, and you will 2 to 4 inches into the gel. So as it's soaking, I'm gonna put gloves on. And I want you to tilt your head back and just relax. I'm gonna remove one from this tube. So with going in, I'm gonna go upward, and once they hit to the pharynx, that's when they're gonna start coughing, and that's where I would tell them to put their chin to their chest and begin drinking water, and I will go backward and downward so that it can get down to the xiphoid process completely. So just relax and swallow and never force it. And like I said, if he began to cough, I would check with my tongue blade at the back of the throat, and it's most likely the tube has started to curl up, and I would just slightly come backwards, and then I would straighten the tubing, and I would persist with going downwards. But if they started like turning blue or gasping, I would stop completely, and I would remove it because it's most likely in the trachea. And now he's starting to cough, so I would tell him, drink your water, Mr. Jones. Chin the chest. That's as far as I can go due to it not being a real person. So I would slightly, you wouldn't have did that. So I'd kept it at my marking. You just want to take it and you can tape it to the nose or the tree. But I sure grabbed that piece of tape. So just make sure it stays on your marking and just tape it to his face slightly. Don't tape it, it doesn't need to be tight. And then I would go get him his x-ray. And once he comes back from the x-ray said that it's in place. And now I would come to the pH. For some reason mine doesn't have the clip. Well, there was supposed to be a clip. Anyways, it would have had the plastic cork, and I would take it out before I would bend it, and I'd take out the cork, and I would get my syringe, place it in there, I would pull back about that much, and you want to check color and consistency. It's brown, so I know I'm in the stomach, and then keeping it clamped in my hand, I would disconnect, put it in my pH paper, make sure it's less than 5.5, and it is. So if I had my cork, I would place the cork back on, place it down, and then I'd get my skin barrier, clean the nose. That just helps the skin not from being irritated. I'm gonna remove my gloves so I can rip the tape. What you do with a piece of tape, take it, and you rip it down the middle. Don't rip it all the way down because you want to keep it. I'm just gonna place it on the nose. And before I tape it, I'm going to use my measuring. So from the tip of the nostril where the tube is, I go all the way down. Don't pull because you don't want to pull it out of the stomach. So then you want to remember that number. And you can remove it from the face now. I'm going to take this piece of tape off. It's not going to come off, so I'm just going to wrap it. And you go with one piece, you can go under or over, it doesn't matter. And with the other, do the opposite of what you did. And after doing that, tell him to turn his head as much as he can. And I will get my rubber band thing ready. But just one more time, measure it from the tip of the nose down and make sure you still have 51.5 because after putting it in place, you might have yanked it some and it might be on the stomach. That's 51.5. So now I can take it, move that down. You just want to button it, flip it to the sharp but not too much. And once their heads, they should be able to still turn it with enough on each side. And then now he's got to be hooked up to suction. So I would have taken my cork out, it clamped in my hand, and connect it to my suctioning and place it above the head level. If there was a double lumen, you would also keep it above the head. You just don't want to put it down at the below the head because then the pancreas juice can go back up. So with keeping it up, it can't go back. It has to keep and go into the suction. And then once it's above, they're connected. Turn my suctioning on. And I would give him tissue just in case he had extra gel on his face. And I would remove my supplies. And I'm just going to put them over here because I got to keep the stuff. And then I'd lower the bed, assist him if he needed oral care every 2 hours. Lower the bed, make sure he has his collar, and just frankly check on him. But I do have an order to remove, so now we're going to remove. So I'd come in, raise the bed, put him in high filers again, explain that it is going to be discomforting, but not as discomforting as putting it in, and then I'd place the towel over him. You first want to check for placement. Turn off the suctioning, clamp my tube, unconnect them, put my cork back in, place this here, disconnect from the air. So then I would grab my thing, clamp it in my hand, disconnect. Still brown, so stomach. And then I'd get my normal saline, about 10 mLs, and I would put it in, and I'd flush the tube to make sure the tube is clear of any juice. And then I'd put the cork back on. Gently. Okay, Mr. Jones, we're going to be removing it now. I want you to just take a deep breath in. We're going to remove it. So just hold your breath. And I would coil it in my hand and tilt his head back. And as he's taking his deep breath in, I would pull it out. And then roll it in the thing. I would throw it away, but I got to keep it. Then I would assist with nasal care, oil care, lower the bed, and lower how he wants it. Open the curtains if you wanted me to, and I would document whatever